Hello, my name is Natalie Clements. I'm an ST3 anaesthetics trainee based in the west of Scotland. The high-risk obstetric anaesthetic clinic at Wishaw General Hospital reviews pregnant women before 36-week gestation with a variety of comorbidities or specific anaesthetic concerns. The aims of the service are to identify, inform and plan for patients who may need specific anaesthetic management during labour or at caesarean section. Women classified as high risk for anaesthetic complications may be concerned in the lead up to birth. When we know that emergency surgery will be an outcome for some, this clinic offers us an invaluable opportunity to prepare patients for such eventualities. Oftentimes our intervention only involves detailed explanation of the options for labour analgesia or the options for anaesthesia. We assess the overall satisfaction that these patients had at the end of their anaesthetic management. We hypothesised that antenatal clinic time would increase patient satisfaction. From January to the end of April 2021, electronic records of every patient who attended the high-risk anaesthetic clinic were reviewed. Patients from this cohort who underwent an anaesthetic procedure in the end were interviewed. The patients were asked to rate their satisfaction with the anaesthetic management as high or poor. The results of these surveys were collated. 32 patients were assessed in the clinic over this period. Of the patients seen in clinic, the most frequent intervention was actually information only. 22 high-risk patients, so approximately 68%, proceeded to have an anaesthetic intervention at the time of birth. 40% of these procedures ended up being complicated, the most frequent complication being difficult regional analgesia or anaesthesia with more than one attempt. Follow-up surveys were taken in 13. In the surveyed patients, 11 reported high satisfaction with their anaesthetic management. 2 were not satisfied. In conclusion, the population surveyed was small, and we need to encourage survey participation in our postnatal patients to achieve more robust data. A high investment of clinic time has been shown to be used for explanation. This is considered valuable given that most patients who went on to review their anaesthetic management expressed positive satisfaction, even in the patients that suffered complications. A considerable portion of our high-risk clinics will go on to have an emergency caesarean section or an anaesthetic procedure that is difficult or complicated. It is particularly in these scenarios that preoperative assessment is valuable.